the reason this is the most exciting and useful thing I have done in my whole career is that when I see health workers do things differently and have an insight, and they say, so that's why. Now I can do it differently. I didn't know I was hurting that person. Why didn't anybody tell us these skills before? Why didn't anybody teach us these skills before? And when I meet people on the street, whether here in Kilifi or other places that have been through the training, and they come over with a huge smile and give me a hug and say, Anna, thank you very much. I know that these skills make a difference in people's lives. They make a huge difference in people's lives. So that's why I am excited about this.
So this is a communication skills and emotional competence training for health providers. And the aim is to strengthen health workers' skills to communicate professionally and to manage own emotions and patients' emotions at the workplace. And why emotional management? This is so key. As we know, health workers go through a lot of emotional challenges in their work. They meet patients when they are most vulnerable. Patients go through a lot of fear of illness, and health workers are not well prepared in their professional trainings to handle these emotional challenges. We know they are prepared in terms of technical skills, but the skills to care, they are not. There is no much focus on building these skills.
And I think it is like this because it has been developed from the bottom up. That these doctors and nurses I started working with in Lithuania, in a TB hospital, tuberculosis hospital, they had problems and they didn't know how to deal with them. And when we worked with them together to look at what are the emotional challenges here, what are the communication challenges, and it made sense to them what we did, and we tried it out together, then they saw how they could solve problems and how they would work together in a different way without all the hierarchical power stuff that was bothering them, but is there. Mm-hmm. But they could come across that, they could come past that, and it really made so much sense to them.
So what we are seeing when providers go through this process training, they acknowledge that now with the skills they are able to see patients as persons, as fellow human beings. Because more often, health workers, we tend to see patients as diseases. So diabetes is a diabetic patient, is a hypertensive. But with these skills, health workers are now able to see patients as persons, as fellow human beings, and relate to them in a more humane way with a lot of respect, and putting themselves into the shoes of the patient and see if it were me in the shoes of that patient, how would I like to be handled. So they're more human, and also in terms of managing emotions, they're now able to recognize their own emotions and also recognize patients' emotions and step back from acting out automatically to emotional challenges, and find reasons behind patients' behaviors. Why is the patient behaving this way? So that's very important, because once they know that there are reasons behind patients' behaviors, then it enables them to focus on patients' needs and concerns, as opposed to the acting out in a more automatic way to emotional challenges.
They understand why it works, and it's such a relief to them. And to see this relief and to be part of that is very important to me.